Welcome, everybody. It's Dr. Alicia from She Found Health Motherhood Podcast. Today, we are going to talk about something that a lot of women actually have to deal with in pregnancy, and that is heartburn. We know that up to 80% of women suffer from heartburn or acid reflux in pregnancy. The symptoms can often worsen as the pregnancy progresses, and typically it improves postpartum, unless you suffered from it before you were pregnant. Complications of acid reflux are pretty rare, despite sometimes it feeling like it is super severe. In this episode, we'll talk about the symptoms that it can start with and why it kind of starts and worsens in pregnancy. We'll also discuss some other medical conditions that can mimic it and why it's really important for us to recognize those. And then how we can manage the symptoms with both lifestyle and medication options. So, just as a reminder, the She Found Health podcast is meant for general medical information only. The contents of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply in every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek out the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. And the views expressed by She Found Health and our guests are not representative of any institution with which we are affiliated. Great, so let's get started. Heartburn can be quite troublesome for some women in pregnancy. It's uncomfortable and can often worsen nausea and vomiting in pregnancy, especially during that first trimester. It can affect sleep, and that is challenging enough at the best of time during pregnancy. Most women experience a burning sensation in their chest or a metallic taste in their mouth. Most commonly, this happens after meals or when women lie down. Some women can experience a change in their voice, so it becomes more raspy or a bit of a chronic cough. If you are experiencing any symptoms like this, it's important to discuss those with your healthcare provider, especially if they come on later in pregnancy or you haven't really suffered from them before. And we'll discuss why that's important a little later in the episode. So what causes heartburn in pregnancy? Well, our body releases progesterone, which is a hormone that's increased throughout pregnancy. Progesterone is really important in pregnancies to help support it, especially in the first trimester. One of the many things it does, however, is it decreases the muscular ability of our sphincters. So one of the ones that is important for heartburn is the one that separates our esophagus and the top of our stomach. So normally that helps to keep contents of our stomach in our stomach. But because it's loosened in pregnancy, you're more likely to get the acid in your stomach coming up into your esophagus, causing those symptoms. It also can slow the bowels and the contents moving from your stomach into the small intestines. So this adds extra pressure, which we don't need in pregnancy. So this, accompanied by the increased pressure of the growing uterus, can make for some pretty significant acid reflux. Now, obviously, some of these things we can't do much about, but there are a few things that we can do to help just a little bit, and that is where our management applies. So we talked earlier about being cautious about new symptoms that are coming up later in pregnancy, or that seem to come out of the blue, or dramatically worsening symptoms. So there's a couple of things that can mimic heartburn and cause similar symptoms. The first one is called hypertension in pregnancy. One of the symptoms that women can experience with this is heartburn or pain in the right upper side. It is important to know that if this is the case, so if you have significant heartburn starting after 20 weeks of pregnancy and you have not been suffering or it gets significantly worse, you need to talk to your healthcare provider and you really need to check your blood pressure. You can do that at a pharmacy, you can do that at home, or you can get seen quickly by your healthcare provider to do that in the office. We need to make sure that your blood pressure is normal. Another thing that can mimic heartburn in pregnancy is having gallstones, so having those little stones in your gallbladder. Now that pain is more of the pain of the right upper side of the abdomen. It can often come on worse after eating, and it can radiate or can go into your back as well. So this is also an important one that your provider needs to hear about. So if you're having symptoms that are similar to this, please do talk to your healthcare provider. So if you are in the second half of pregnancy and you're starting to think about labor and delivery, make sure you check out our best birth guide. So you can find that at www.shefoundhealth.ca/best-birth-guide. We'll link it in the show notes below. So we've talked about kind of what is heartburn, what are the causes of it, what are the symptoms that you might experience. So let's go on to how can we help manage those symptoms. So heartburn in pregnancy can be mild to severe, and it can make nausea and vomiting worse, and it can affect sleep. We don't need to treat it if it's not bothering the pregnant woman, but if it's affecting her day-to-day life, then we have some options to help, and we'll go through them in a stepwise approach. So, first things first, look at the foods you're eating. So we know that there are certain triggers for heartburn in pregnancy, and those are the same as for non-pregnant women or non-pregnant people. So avoiding those things can help improve heartburn to a certain extent, and a lot of those are based on increasing the acidity in your stomach. So foods or drinks that can worsen heartburn include caffeine, alcohol, tomatoes, citrus, chocolate, garlic and onions, spicy foods, and peppermint. So have a good look at your diet and see where you can modify it to decrease those foods. Now, the next focus on lifestyle management. So we know eating close to bedtime and having large meals can really worsen heartburn. So do your best to eat small amounts of meals throughout the day rather than focusing on 1 or 2 big meals, and really avoid eating before you go to bed. Gravity can also help symptoms of heartburn, so if you stay a little bit more upright, you're going to be keeping that contents in your stomach a bit more effectively. So some women find that raising the head of their bed or sleeping in like a lounge chair can really help their heartburn. We also recommend not eating 3 hours before bedtime and avoiding wearing tight constrictive clothing around your belly. So the third thing that we would recommend women trying are antacids. So Tums is a cheap and easy way to improve heartburn in mild cases. It actually acts as a source of calcium as well, so it does double duty in that sense. But we want you to limit your daily intake to less than 6 extra strength Tums a day. So that's 1.4 grams of elemental calcium. And if those things don't work, then the next step would be medications. If you're unable to manage your symptoms with diet, lifestyle, and antacid therapy, there's a few medications that we can prescribe that have excellent safety profiles in pregnancy. The 2 classes of medications we use are histamine blockers, such as cimetidine or famotidine, or proton pump inhibitors, such as pantoprazole or omeprazole. These both work to decrease the amount of acid produced by your stomach. So there you have it, heartburn in pregnancy. Let's recap. Number 1, it is very common and can be treated by both lifestyle modifications and medications. Number 2, it can worsen nausea and vomiting early in pregnancy. So if you're suffering from those, make sure to treat the heartburn as well. Number 3, there are a couple of medical conditions that mimic this. So if you have new onset heartburn later in pregnancy or sudden worsening, please discuss with your care provider relatively urgently. Number 4, try not to suffer. There are things we can do to help. And number 5, most women get relief after delivery. All right, so we hope that this has been helpful. We would love it if you could take a couple of minutes to leave us a 5-star review on wherever you listen to your podcasts. If you are starting to think about your upcoming birth and getting anxious about what it might look like and how you're going to do, make sure to check out our best birth guide, and we'll link that in the show notes below. We give you some great tips on how to prepare to have your best birth. Also, check out our website at www.shefoundhealth.ca and sign up for our community for our weekly bump blast on all of our free content and any deals or upcoming events that we have to offer. So have a great day. Take care.